And I'm a Year 5 medical student from Chian School of Medicine in Singapore. Today, I will be presenting my abstract entitled Retrospective Review of 5-Year Outcomes following the use of Gynecare Prolift transvaginal mesh system in pelvic organ prolapse surgeries performed between 2011 and 2012 in KK Women's and Children's Hospital. I worked on this paper under the supervision of Professor Han and Dr. Jill Lee, who are both urogynecologists in KK Women's and Children's Hospital. Before we begin, here are my affiliations as shown in this slide. Gynecare Prolift is a type of polypropylene transvaginal mesh system that's used in the treatment of pelvic organ prolapse. It works to increase the long-term pelvic floor stability as well as support. Insertion of Gynecare Prolift is minimally invasive and shown to be effective in resolving symptoms such as urge incontinence. However, in 2008 and 2011, the FDA published articles showing high rates of complications, including mesh extrusion, prolapse recurrence, and low patient satisfaction. As a result, the sale of the Gynecare Prolift was stopped in 2012, and eventually, sale of all types of transvaginal mesh was stopped by the FDA in 2019. Hence, the aim of this paper is to provide perioperative and long-term outcomes to clarify the role of transvaginal mesh in pelvic organ prolapse management and preoperative counseling. This study included the use of 3 types of Prolift. This includes anterior, posterior, and total Gynecare Prolift, which was used for different combinations of prolapses. All of the surgeries were performed in the same hospital institution from January 2011 to September 2012, and all of these surgeries were performed by one surgeon. Operative outcomes up to 5 years were recorded, and the results of which are in the following slides. This table shows the preoperative characteristics of our patients. Most patients had a history of at least one normal vaginal delivery, and one thing to note, important statistic would be that 21.1% of patients were sexually active at presentation. This is significant as sexual intercourse has been postulated to increase chances of complications with transvaginal mesh. The most common symptoms that patients present with were frequency, nocturia, stress incontinence, and a lump at the introitus. As seen on the table on the right, most patients that were operated on had high degrees of prolapse in at least one of these 3 compartments. For intraoperative details, 81.1% of patients were implanted with the total Prolift system. Common concomitant surgeries performed included vaginal hysterectomy and posterior repair. The average hospital stay for patients was relatively low at an average of 3.93 days. This was also associated with very low rates of intraoperative complications, namely bladder and rectal perforations, as well as the need for blood transfusions. Patients were followed up and monitored for 5 years post the operation, and the results are as follows. The rate of mesh extrusion was approximately only 1% amongst all patients. Similarly, dyspareunia was reported in 1% of patients across the 5 years. Pelvic pain was experienced by 2.8% of patients in the first month post-operation, and subsequently, no other patient presented or complained of pelvic pain. Prolapse recurrence rates were also low across the board for cystoceles, rectoceles, and vault prolapses. And finally, patient satisfaction was maintained at 100% over 5 years post-operation. To conclude, the results from this paper has shown that Gynecare Prolift is an effective and safe option for pelvic organ prolapse treatment in Singapore, as seen by the low rates of complications. Despite presenting with high grades of pelvic organ prolapse in multiple compartments, most patients achieved favorable and sustainable long-term outcomes with high patient satisfaction and a cure rate. Lastly, an important factor resulting in low complication rates among our patients was an experienced surgeon who was well versed in operating using transvaginal mesh technique. Thank you so much for your kind attention and have a great day ahead.